Good afternoon and welcome to Formfast Enterprise Workflow 101 featuring Fast Flow for logic-driven workflow applications. I'm Ed Corba, your host today. Our guest today is Sean Curtis. He's Director of Marketing and Product Development. Today, Sean and I are going to explain and show you how Fast Flow can fill your needs for a software that is not only easy to use, but has quick access, manageability, tracking, routing, authorizations, security, governmental compliance, and has storage options for all electronic forms that you want to fill right in on the screen. So first, let me begin by letting you know exactly who Formfast really is. More than 1 out of every 5 hospitals in North America choose Formfast to lead them through their EMR process. Formfast is the company that helps you with printing and workflow processes. Any application surrounding the paper process can be eliminated or greatly improved while running documents to cold feed for the electronic medical record and on the screen with logic-driven workflow processes. Let's welcome our guest today, Sean Curtis, and let's begin Workflow 101.
Good morning, Ed. Thank you very much. And everybody, welcome to Workflow 101. And you'll see that I've added the subtitle of 101 workflows that drive your hospital performance. And we're going to look at workflow in a little bit of a different fashion today than a lot of healthcare and hospitals have looked at it in the past. The way it's looked at typically in healthcare is a departmental type of problem, departmental solutions, built into maybe an application at some way or some level. And what we're looking at is laying a baseline and a reusable structure for automating workflows across the organization. We're going to show you how that's done and get into the definitions and talk about workflow at a beginning level and build up on how to improve beyond that. So we're going to start today with, workflow defined. It's just simply a process of completing a series of tasks. So it can be very simple with only one person who uses an application to complete a task that writes to a database. Or it can be as simple as one person filling out a form that then goes to their supervisor for an approval or an okay. It can be even more complex where it requires things like more than one approval, signatures, logic that drives to the determination of where this needs to go. It can involve groups of people. It can also involve collaboration. So people need to, not only just one person give it an okay, but maybe several people need to provide input and have some discussion on the topic before it can go forward through this approval process. So an easy way to understand it is, requesting blank requires approval. Put whatever you want in there. It could be a box of pencils. It could be an X-ray machine. That's an example of a workflow process. It requires a form. Somebody fills out the form. They submit that to the approval authority. There might be some business rules. If it's a big piece of equipment, maybe it needs more approval level. So it gets through that approval process, and then it comes back to the initiator who then is ready to either go out and purchase his machine or not. So that's just a simple idea of it. Other workflow processes drive applications. They're not processes for approval, but they're actually processes for onboarding employees. Things have to be done when you hire a new employee. So those are examples of some workflows, and we'll get into what some examples are a little bit further down the road here. So understanding your workflow, it takes a little bit of analysis to understand what your workflow really is. You can think about things in a simplified format like I just discussed, but digging deeper into that is important when you want to go to automating or improving your processes. So, the steps of doing that are to evaluate your tasks and the timeline and the outcome of each of those tasks. So then you can start moving towards improving how each of those tasks are done. Thinking outside of the box and the order and the method of completing the task within the workflow. See how you can optimize those. And question the necessity of each of these tasks. When we move from a paper-based process to an electronic process, some of the tasks are not necessary anymore. Some of the things like the format of the paper, the look of the request doesn't have to be the same as what it was in the paper environment. In the electronic environment, that can be improved on, and and tasks can be automated and done by the computer. So if it's a logic-driven task, if it's because a value on the form is greater than a certain number, in the past you might have had to have a person review that form and then route it. Today, with automation, you can automate that. The computer will look at that number and decide where it needs to go. So then once you get an understanding of your workflow, then it's time to apply technology to that process and automate it. So what's automated workflow? So applying the technology that will reduce, simplify, eliminate, or expedite those tasks. So like I was talking about, we want to make those tasks easier for your end users, so simplify them, make fewer tasks. If we don't have to have people involved in this process, eliminate those tasks. And that's what this workflow tool helps you do. It helps you understand your processes, helps you optimize those processes, and bring them to your users in an electronic environment where you can support more features, collaboration, and things like that. So what are those benefits? You know, the collaboration is a feature. Eliminating some of the tasks brings speed into the process. So now the process that in a manual environment took weeks to accomplish can be done in hours or days, because we're really eliminating things like delivering a paper, gathering a group together to review something. Now you can do that online when people are available. They can do it on their own and see all of the issues raised and everything along the way, and kind of input in an online collaboration tool. So, you know, in your hospital and in every business, labor is one of the biggest operational costs. So we want to focus those people on using their unique talents and their background and education to do their focused job, rather than focusing them on data entry and understanding processes that aren't core to their jobs and their roles. So beyond that, then accuracy is a great benefit of this too. We're going to be reusing data. We're going to enter data from databases that's already there. We'll be able to enter the information one time and then reuse it. Of course, there's clarity. This is a online application, so we're using text that's been typed in, or you know, using computer fonts instead of handwritten. So legibility is a big issue too. That's going to lead to better patient care and billing and revenue cycle improvements and lower risk. Again, increased collaboration and communication allows your end users, wherever they're at, to work remotely, electronically, seamlessly. So we can get this all done in one environment, regardless of where the players are at. So we don't have to worry about scheduling a meeting. It may take you a month to get 7 people into one room. But with the collaboration tools and the workflow tasks and the automation, we can get that done regardless of where people are at. And that's the way that businesses are working today. Another great benefit of this that you can't really do in a paper environment is the performance monitoring. So understanding where something is at in its process. So you've submitted a request. That request has a process to go through. Now, once you submit that in a paper environment, it's gone. You have no idea where it's at. In an electronic environment, you're able to track that. You're able to look in and see, where is this at? How long has it been there? When's it going to get done? You can also then report on outcomes. So all the data that you've collected through this process of collaboration onto a document can be recorded to a database, and then that outcome can be reported on and reused. And that's extending the lifespan of your data. So now we have this data integrity. We've entered it one time. We don't have to worry about somebody miskeying something. Once we get it in there and it's correct, we reuse that data. So we don't have to continually key that information in, and then we can reuse it in new ways. We can generate reports. That data going into a database or onto another application can trigger other events. And this lets the workflow grow throughout the enterprise. It's also giving you data that's available for audits and tracking, analysis of your performance. And, you know, in the hospital environment or clinical environment, you could collect, non-patient identifying information that would help you do research studies. So where is workflow automation really big? Probably one of the biggest areas is manufacturing, financial services, and government. As I said, healthcare has some, and it's specifically targeted usually in healthcare. But in other areas of other markets, they take this as a very important problem to solve, is working more efficiently and improving their processes. So some examples of what is process improvement, you've probably heard these terms before: Six Sigma, Lean Six Sigma, the Toyota production system. and straight-through processing. Straight-through processing is big in the financial environment where they're trying to eliminate or reduce the amount of time it takes to process a financial transactions, particularly trading stocks and things like that. They want to get that done as fast as they can because prices fluctuate every fraction of a second. Production, manufacturing, and lean and on-demand manufacturing type initiatives are very big in other industries. Now, in healthcare, as I said, it's been deployed more in a silo. It's a piece of an application that's targeted towards one thing may have workflow related to that one thing. But outside of that, there are a lot of holes in the system. So what we want to work towards is laying a groundwork here, a baseline that you can build off of across the enterprise rather than siloed, non-integrated solutions. So we want to be able to have an integrated solution that works across departments and that has targets everything across the organization, from clinical to the business management to the financial side of it to the billing side of it. All of this can be done with an enterprise-wide tool. Now, another thing about healthcare too is Formfast has already been automating some workflow in healthcare since 1992, and if you're a customer of ours, you know that. We've been automating the process of the workflow of admission packets and chart forms and on-demand things, where basically we electronically eliminated some steps involved in just generating the documentation for patients and universal billing forms and those types of things. So we've been in many parts of the organization already in print automation and automating that type of a workflow. But these are just granular, small examples. And we want to move away from that silo because there are new pressures that are coming onto hospitals, most notably the EMR, that are driving hospitals into wanting to be able to collaborate more, share more information, and manage workflows and improve their processes. So now we get into some of the 101 workflows that drive hospital performance. So really hospitals are primed for this. They're ready for it with the onset of EMRs coming in, the pressures from government coming in to work more efficiently. And, there are increased regulatory pressures, reporting pressures for HIPAA compliance and for SWIFT and for SARBOX and all those governmental requirements now coming down the pipe leads to a lot of pressures on hospitals. The new RAC audits, Medicare, Medicaid, being able to look back at the last 3 years worth of billings that you've submitted to them. That is going to put a lot of pressure on hospitals to have processes in place to deal with those audits. We're going to talk more about those audits in detail later on in this meeting. So not really a pressure, but one of the other driving factors is that there is an increased systems integration and information availability in hospitals. So now as smaller parts of the organization are all coming online and coming into sharing information more and more, that really opens the door for an enterprise-wide interoperable system that will manage workflows in this type of an environment. And of course, with all this regulatory pressure and pressure to perform and lower reimbursement levels and things like that, there's a greater focus in hospitals on revenue integrity, making sure that what's billed is accurate and correct and gets paid. So that's part of the areas that a workflow solution can affect. And then the competitive pressures that are leading to this are, of course, you want to deliver your patients the best experience you possibly can. So that's where we get ratings like the 100 most wired hospitals and things like that. So the more you can deliver to your patients and the more efficient and effective you can be toward your patient's experience, the better off you're going to be as well as a business. And then, of course, keeping physicians happy. That's probably number one on the list of a lot of hospitals and organizations, is keep those physicians happy, keep them bringing patients to your hospitals, and make sure that they use their time efficiently and effectively, and they aren't mired up in this process jungle that you may have. Rather, automate it so that it's easier for them to use and understand. And of course, then kind of a directional focus is to be more operationally efficient. And operational excellence is one of the other drivers towards why hospitals are looking for workflow automation solutions. So this starts the list, and then I want to go back to telling you to slide number 2, where I said, basically a workflow can be as simple as requesting blank, insert your thing here, requires a workflow. So I have maybe 30, 40 workflows that I'm listing here, and this is just to spark some imagination on your side. Every business works differently. Every hospital has different challenges and pain points. So these are just a few things that we've already identified, and they can be important to you, and there's probably more that are also important to you. We'd like to work with you on that. So I'm not going to list 101 if that's what you're hoping for. That would take a little bit of time. So I'm going to just kind of throw these up on the screen and talk a little bit about the whole overarching idea of revenue integrity. Revenue integrity, making sure your billing is accurate, on time, and complete. The CMS RAC audits, that's a big threat to hospitals. So they could be hit with hundreds of requests for records from an auditor. There needs to be a way for the hospital, first of all, manage just the request for the records. Tie that into what happens after the requests have been sent. We need to track that. It's on a timeline. And then dealing with the denial, the request to recoup that money that's been paid to you, and appealing that and managing the levels of appeal that could happen from that. So there's a lot that can happen within that RAC audit. There are other audits that happen in the hospital environment as well, so insurance audits and things like that. So our tool is built around the ability to provide the functions that are needed for managing these things. Of course, the charge master update, being able to have a shared electronic way of requesting changes to the charge master. Sounds like a small task, but it's really a big task, and we can manage and maintain that charge master in an automated way. So there's, go ahead and look at this list for a second. There are a lot of different things there, and I'm sure you can think of even more than I can. In the clinical experience area, there are things that can be deployed that will make it easier for your patients to get into your hospital, make their time better spent in your hospital, and give them a better overall experience. So an admissions kiosk, allowing patients to fill out pre-admissions online, allowing for scheduling operating rooms or pre-admit scheduling through an electronic interface that's integrated into your system. All of these can be put in place rather easily if you have the right tools. Then we get into compliance again. So not only HIPAA, but now you have JCO audits and inspections and things like that. So they're going to look into your policy and procedure management. How are you doing that? So we have a tool that allows you to manage and distribute and maintain the up-to-date versions of all of your policies and procedures and all those documents that need to be attested to, that they've been signed off on by everybody who needs to know. So then with this tool, you can also use the workflow side of it to distribute that and then collect sign-off from all of your employees who need to know, who need to sign off on this, to collect 100% awareness of this change in the documents. Incident reporting, physician credentials is one area that can be a very long process. And by making that an automated process or automating pieces and parts and putting in tasks and requests and integration into that process, it can really shrink the timeline on that credentialing process and automate it, and then also get it all electronic. So you're also not storing paper documents anymore. You can get that electronic, and you free up some of your floor space. Allowing your patients to sign documents electronically or collect patient information and signatures at bedside, or allow doctors to fill out electronic forms at pre- and post-op. That's another way to make sure that those documents exist and are collected properly and in place. The other thing here is the clinical documentation approval process. So every hospital has a forms approval committee, and that committee probably meets physically in a certain area or a certain time frame and reviews forms and documents. But this can all be done online. So it can all be done through a process of collaboration and workflow and tasks. Again, freeing up people's time, let them work more efficiently and effectively. Another area is supply optimization, making it easier, making it faster for your employees and your workers to request the things that they need, or manage the contracts, understand the relationships with vendors by looking through this system to find contracts and to approve contracts, new contracts, or contract changes that require collaboration and approval levels. Printing personalized forms on demand, eliminating pre-printed forms, and eliminating if anybody's using embossers or labels. That's a workflow. Just putting a label or embossing a pre-printed form. Those are workflows, and they can be automated, and many of those steps can be eliminated. Now, administrative excellence goes into some of the business office and a lot of the HR, and this is really more of a broad category than just HR. I don't want you to think of this as just HR applications. There are a lot of things that can be balled up under administrative excellence. But one of the, let's just go through some of these things on the list. We've got certification, being certified, and you have to recertify, or certain employees will have to recertify at a certain time interval. So we can have reporting on that. We have dashboards that say who needs to be certified, or we can have automatic triggers that will start the certification process, or at least get the process moving to where we can collect the certification papers and do that all online automatically. Employee records, automating this from the beginning, from the time somebody applies, creating their record electronically, and then creating everything under that electronically is going to have huge benefits for being able to pull somebody's record quickly, find it, understand where they're at in their certification or even their immunization records, making that searchable, making that available quickly and easily is another type of workflow. More down the road of administrative excellence with the report management and distribution. So identifying, based on some of the processes that you're working through with this tool, identifying what is a performance indicator, what tells me I'm doing good, what tells me I'm doing bad in my business. One of those could be how many times does a coder have to ask a question to a physician about a code where they don't understand what the procedure was. So if you can identify that this procedure triggers a lot of coding queries, then maybe there's some education that needs to happen to the physician or to the coding team to help eliminate that. Every time a coding query is submitted to a physician, you're taking time of getting that claim into and getting paid. IT work orders, just automating and having a task list and reportability that says we did report, we did ask for, certain, application access. So the new employee needs access to the EMR system. They need access to this system. So those types of work orders can be automated. Print management, eliminating these, pre-printed forms, and distributing print or electronic documents is also another type of workflow. Now we get down to the physician happiness side of it. Of course, that's going to include things like being able to work remotely from their office to submit referrals into your system or pre-book ORs. Things like that. Those are things that should and could be automated. Automate their standing order sets so that if physician has standing orders that they always uses, they can easily just go to those, have them prepared, modify them for each case that they need to, and have them submitted quickly. Again, the credentialing, recurring over and over again, make sure that they're up to date on the credentials. That can all be triggered and can be automated and stored in an archive. Allowing for speech recognition, that's one of the things that helps with the physician happiness in the application. So allowing, deploying software technology is one thing, but then making it more usable is another thing too. And we have consultants that help with determining workflows and determining best practices as far as deploying and automating systems. And then again, the integrated communications outside of the hospital facility, that goes back to what can a doctor do from their office and allowing them to do as much as possible with your hospital from their office. So where do we start? All those benefits sounded good. We saw a lot of workflows that are possibilities. And a lot of these workflows do fly under the radar. They're just unnoticed. So if you start out by grabbing one of those unnoticed workflows, you're probably not going to have a lot of success. What you want to do is probably look for a visible solution that's going to have an immediate impact. So we want to get out of this trend of letting a department see a departmental issue and find a departmental solution. We'd like to go into that department and say, we have this great enterprise-wide solution that will work just wonderfully for this department as well, and deploy in a department and then let that spread. Look upstream from what the workflow is doing and look downstream from what that workflow does and break it outside of those walls of the department and move it enterprise-wide. One important thing is that this does have to have some C-level buy-in. So you need to have sponsors that are on board with operational improvement and process management. Another thing is that the right physician involved in this process can drive change. I've seen that firsthand where a physician can request something that has not been on the table at all before, and suddenly it is priority one. So if you find a physician who has an issue with a way that things are done or a workflow that can be modified or changed, that can be a great ally for you. And then the other person is that squeaky wheel. The squeaky wheel who maybe doesn't have a huge problem, but it's easy to fix problem, but you just don't have the technology for it right now. We can provide the technology at a price point that's acquirable and fix that problem. And if you find that squeaky wheel who's vocal about the problem and is also vocal about the solution, that can help you spread this across an enterprise. So going back to our examples, I wanted to share with you the audit management. Right now I'm going to show the RAC audit, but it's actually our automated audit tracking and response system. So it's not only for RAC audits. It's capable of managing any other type of audit. And again, that is built on, it's just another application of this enterprise-wide workflow management solution. And the other workflow solution that I want to show is the purchase requisition. This is going back to the simplest scenario, requesting blank requires approval. And I'm going to show that one first because that kind of gives us a baseline of a starting point. And then I'll go into more detail about what the audit management looks like, where we're actually looking at collaboration and sharing images of documents and doing some discussion. So for our purchase requisition, there's really only 4 people involved here. If you see my diagram here, we've got the first person who initiates this. They want to purchase something. The next person is probably their manager. The manager has to approve that they can even do that. The next person is separated by this wall here. This wall is business process or business rules. So we're going to determine if this is something that needs a higher level of approval or if this can be approved by the department head and then moved into purchasing. So we have a business rule that says if this form is a request for something over $10,000, we're going to send it off to a vice president who's going to give it an approval stamp or not. And then once he does that approval, it'll go down into purchasing. If it had been under the $10,000 mark, it would go straight over to purchasing because the department head has the approval authority for that number. Once this has all been approved, we're of course going to notify the initial requester so that they can go out and purchase whatever it was they're asking for. Maybe complete this form and write it to a database for later reporting and auditing and tracking, and maybe even send it off to another system or to our print management system to print out purchase orders or other requisition type documents. This is the login screen that nobody ever sees. I have to say that because I'm doing this as a demo, so I have to log in myself as 3 different people here. In deployment scenarios, we don't do that. In the deployment scenario at a hospital, this is seamless. So basically, you open our application, you are logged in as yourself, and you never see a login screen. So you don't have to manage another username, another password. I'm just going to log in as one of our standard users here. So this is the first time you've probably seen our software, so I'm going to just take a second to give you the layout here. What you're looking at is our application directory. So this is where we keep our applications, and it's kind of a catalog of all the applications you have available. You'll see that it's sorted by category, and these categories are customizable at your site. So you'll put these applications into the categories that you want them in, and they can live in different categories. So you can have some of these applications in 2 categories, and it's not going to mess anything up. It's just a way to make it easier for your users to find it. you notice that when I logged in as Kevin Hogan, one of our sales reps, I came into the workflow demos category because that's his default. So when he logs in, he wants to demonstrate one of these different applications. So he'll be right here for that. When I log in as the next user, I'm going to log in to my workflow inbox, and you'll see that. But because that user doesn't start the workflows, they're more of the recipient. So they've just, it's a personal user setting to log in into that workflow inbox. So to start this workflow, I'm going to click the Start button next to my purchasing request, and what it's going to do is ask me for some content, what context is this, who's the vendor. So I'm going to look at, this is my vendor number that I happen to know. So what that does is it goes out to the database of all my vendors, and it picks vendor number 111222. And on the right-hand side of this form, it's configured to put that vendor's information in there. So you see the name and the city and the address and the phone numbers. But also on the left-hand side, it also looks to see who I am, who I logged in as, and it puts my information onto this form as well. It also puts a time and date stamp on it. So I'm not keying this information in. I'm just worried about keying in the content, making my request. So there are, just to look at this form real quick, the business rule is plainly stated right there on the form. So in the paper environment, somebody had to look at this form and figure out if it was needing a VP approval. I'm going to show you that we do this behind the scenes. So when Kevin submits this form, he doesn't need to know where it goes. It's going to go down the road, and we'll take care of that based on business rules. So what that did is you can see that this is a smart form. So it has calculations that extend it across. It did the math for us. It's going to extend that across, and it's also going to extend it down to this total. This form doesn't have a lot of interactivity on it, but we also do forms that have drop-down menus, radio buttons, check boxes, things like that speed up the process a little bit. Also give you better assurance that the data is exactly as it's supposed to be when it goes into the database. So again, this is just doing some calculations across and then down. I'm going to hit the Submit button. So as the first user, that's all I needed to do. The form filled itself out most of the way, and it populated the information on there. I just put in what I wanted to submit. I skipped over that last screen, but what it then showed me is where that went. So at any time, Kevin can log back into his system and look and see where that request is at. It's trackable at any time. So now I've logged in as Joe Miller, who's the department head. So this would be Kevin's boss. And I'm logged in, and I see in my view, I come into the workflow inbox rather than into the documents grid. This is kind of my work list. So I come in and I have a request for purchase for Acme Distributing. Now what comes up is an image view here, and I can see basically the gist of it. I can see what it is and what it's all about. Now if I want to, I can kind of do this rubber stamp routine where I just hit the sign and send. I don't need to open it. I see what's on here, what needs to be ordered. I think that's fine. So I hit the sign and send, and it goes on its way. Or if I need to go in here and actually do something on this form, I can open that form up, and I can put in my business unit information. So I can fill out any of these things that haven't already been filled out. You'll notice that I cannot go in and change something that Kevin wrote. That's one of our security features, that once Kevin has made these requests, I can't go in and change that. So once I've done my part and I've entered my information, then I want to deliberately sign this because I could still go back in. So I've entered a few pieces of information, maybe I'm going to come back to this later, open it again, add some more information to it. I can do that. But now I want to deliberately sign and send this. So I'm going to click the sign and send button, and that kicks in the rule. The rule is if it's over $10,000, it's going to go to the VP. In this case, it's under $10,000. And so I'm going to log out here. I'm going to log in as accounting. So it's a little bit repetitious because the steps are pretty similar, and we'll get into the RAC audit where it's a little bit different in a few minutes. So if I open up as the accountant, Penny Smart, I see this workflow requesting some purchases, and now I have the option of approving it, which would finish this and maybe kick off the next process, or put this into an archive, or a variety of different things that we could do with this information now that we have it. Or I could reject it, and I can click this reject button and say, let's bounce this back to Kevin and say that, you can't buy this without ink. And if I hit the reject button, that would send that message back to Kevin along with the workflow. And then this workflow would go back through its steps. It would clear, here you see an electronic signature from the department head. It would clear that signature. It would open the form back up for Kevin. He would be able to edit this form, send it forward through the approval process, through the business rules again, and reprocess it again. But I'm going to go ahead and just hit the approve button because the steps tend to be redundant. It's a pretty simple system. You log in, you click on your item, and you work through the form. So that's the simple, workflow that we did. We did this little process real quick and easy. The next one I want to talk about is the RAC Preparedness and the RAC Audit Tracking and Response System. So I'm sure you've all heard of what is happening with CMS and the RAC. They do have the ability to come back to you as a hospital who's billed Medicare, Medicaid, and reevaluate what they've already paid to you. So they could take back money that you were paid 3 years ago. And so that could represent a great deal of risk for your organization. Now, what we want to do is give you a tool to manage that, and to manage that in an automated way, to give you dashboards and reporting capabilities and trending and tracking so you can understand what your risk is going forward, what you need to get done today, and what needs to be done, what is in the pipeline. And I'll show you things like our dashboard and our reporting capabilities and things like that. But let's take a sky-high view of what this process looks like. Initially, you're going to get a request for records from your RAC auditor, and that can be, let's say they request 150 records. Right now, they're not challenging anything. They're just making the request. They're going to look at those 150 records, and then they're going to go into a determination phase where they say, of these 150 records, 95 of them, we're going to say we're not valid and we want our money back. At that point, you have to do something. You have to decide whether or not you're going to appeal that. Now, when you think about this, one of the statistics that's come out is that about a third of all of these determinations where they said they want their money back, a third of those were turned over through the appeals process. So if you do nothing, you could lose a third of these just automatically. So doing something, you have the opportunity to at least recoup it, catch them when they're wrong a third of the time. 2 out of 3 times they're right. 1 out of 3 times you could get that money back. That could be a pretty big dollar amount. So then it goes into the appeal compilation. So once you determine that, yes, we want to appeal this, then it goes into the appeal compilation where you're going to discuss this and review it with your group and develop this document that says why the billing that we submitted is correct, and fight this and take it through the appeals process. And then once you've compiled that document, you're going to send it and track communications. And they're going to come back to you again and say no or yes. So when they do that, when they do this, the response comes back, then if they denied it, then you have the opportunity again to go through this decision process of whether we want to appeal to the next level. You have 5 levels of appeal that you can take with this. So tearing this down into each of these parts here, I'm going to break these apart and kind of show you what we have. So the first part of it is kind of the pre-audit process of the records request is very important. So first of all, you have to record the date and the time and when you got this record and when you fulfilled the request. So being able to record that you received the letter and that you fulfilled the request is a big deal because everything is on timelines. You need the ability to scan that medical record and get it into a format that's acceptable to the RAC auditors. They do have a standardized format that they need you to send records to them in. You can export them from your EMR system, but they still have to get into that finalized format. We have, of course, the tool that does that. So whether you scan them or bring them in from an EMR system, we can compile those into the spec that they need to receive for you. And then, of course, you need to deliver those records to the auditor and, of course, track the time, the date and shipping and method and all of that. And then, of course, that triggers the timeline that you have to wait for this response. So then we show this, we can depict this on a dashboard that shows you that you have records out, that there's a pending appeal. So some of the tools that we have to help at this stage are, of course, the integration. So like I showed with the purchase request, we can integrate with databases. So claims data can be pulled into this automatically. You can query your claims database, bring in all the pertinent information about that claim so that you have this at your fingertips in the application. The workflow is going to manage the receipt of the letter, the person's task to fulfill that, either scan the EMR or import the EMR, and then get it tracked and recorded. So that's all part of the workflow. And then, of course, the packaging. Packaging that into the standard format that your auditor needs it to be in. The next stage is they come back now, and they've said of those 200 records, we're going to challenge these 175. So you still need to know that you have 175 things on your plate that you need to deal with. So that's where we have the dashboard and the workflow. And you now are in the point where you're going to make a decision whether or not to appeal this. So that's another discussion type workflow where you can invite the parties that are involved in this to look at this and decide whether or not we want to go to the next step. So you have a timeline on when to decide when you're going to go to the next step or not. And of course that, again, relies on a workflow tool, a dashboard, a discussion tool, and an image viewer, because we've got these electronic images of the medical record that you can now share in one place and discuss in one place and come to a decision on whether or not you want to appeal. Once you've decided that you want to do that, you've got this is where we're at now is the grounds for appeal. Do we want to do that? You bring in departments. The next step, now we've determined that we do want to appeal it, you need to decide who particularly is involved. So is it the attending doctor, the medical records department, staff, department heads, things like that. Bring them into this conversation. Now, this would be a huge task if this was all offline and you had no way of doing this. If you had to have somebody sending paper requests or trying to arrange meetings between all these people, this is why it's important to look at an automation tool for this. Once you get all of that, so we've had this collaboration, everybody's contributed to this through this online portal tool, then you can begin to compile all of that into knowledge to create your appeals document. So the next step is to create this appeals document. And of course, that requires notifying the parties who give you input as you're developing this document. Monitor and review the documents and comments that are coming in, and then collaborate, even sending that document once you've given it a first draft, a workflow to send that around and get more input on the appeal document itself. Sending out the draft and then distributing that appeal letter to the RAC in the response. So you want to track that you've actually responded to theirs. You want to track the date that you met the timeline, and then it also triggers a timeline for them to be required to respond to what you've submitted. So once you submit your appeal, they have a timeline where they have to get back to you. And we can help you track that too. So without a tool, without a tool that has rules built in, without a tool that shows you on screen what's pending, what to do, gives you some clues and highlights about what you need to have done, it's going to be a huge task for many hospitals to do this process. The final part of this is the business intelligence that's involved here. Because once you're doing this for a little bit of time, you can start understanding your trends. You can see problem areas in your hospital. You can go in and make changes to the way you're documenting procedures so that you do get the right DRGs the first time. You can understand, looking at your trends and looking at your reports, what your risk is. You can understand that, in the next upcoming months, you may have a certain dollar amount that you could lose. You can see by DRGs which ones you're winning, which ones you're losing. So if you're getting a ton of denials, you might want to look at your win-loss ratio and pick off the ones that you're winning and let some of the ones that you're losing go. So there's a lot that you can do. This business intelligence is a huge part of being able to make intelligent decisions. So just to look at what our dashboard looks like, similar to what you saw in the workflow tool, we have a specialized dashboard within the workflow tool. It's called the RAC dashboard. And what it does is it gives you a sortable, searchable listing of what's happening, where it's at, what level of appeal it's at, what level of process it's at, what it's waiting on. This one would say waiting for appeal. So you can ask users to review documents. So this one is pending appeal, and it's you've asked somebody to do some commenting on the medical records so that you get some input from those people, and you're starting to gather that knowledge. My annotations aren't that great. What your end users are going to see is something more like this, because they don't need to be concerned about the 200 claims that are pending. They need to just deal with the ones that they're involved in. So in their workflow inbox, they would see a simple request that is asking them to go ahead and review the documentation. They would see a screen that has all the pertinent information on it, the facts of the case. They'd see attachments. If you would attach the denial letter, the records request letter, things like that can be attached to this and flow with it. Also, your draft appeal letter can be attached to this and sent around to have collaboration done on it. This is a look at what our document image viewer is. So once you've scanned in that paper document or imported the electronic medical record, we have two features that are important here that I'm going to try to use my pen tool again. One is the export. So once you've got it into the system, you can export this, and what that does is it compiles all of these documents into the document that's needed for the RAC auditor to do their work on. So it puts it into a standardized format in the format that they've asked for and allows you to send it over to them. It also allows you to have an internal exported document that would, in addition, add the comments into a PDF document so that you can have a PDF document that has the medical record information on it along with anybody's comments or discussion that's happened with that so that they can have that offline or when they want to work on this and don't want to log into a system. Another thing for the online portion of the tool is that you can click on the summary button, and that basically compiles all the comments that have come in from all your end users and gives you a single view of all the comments so you can go through those. Over here you see that some of these have red icons, some have green icons. Green icons have comments on them, have discussion on them, the red ones do not. Clicking on the window would open up the form so you can see the entire document in this browser. So that's, in a nutshell, the RAC audit. So going back again to the whole focus here is one tool that can work across your organization and interoperate with other applications and allow you to build out workflows that will have a meaningful impact on your business operations. This is what we're trying to deliver here, something that's reusable across your organization.
I want to thank Sean Curtis for being our guest speaker today. I'm Ed Corba, thanking you for also being here today and wishing you the very best for 2019.